All right, let's consider anatomical positioning. Anatomical positioning is when either a model that is a human or a model that is a bird, anything, is laid down, right, or standing up like we have for a human here, right? And what you're gonna have, and the most important thing is that you see the anterior or front of the skull, you see the front side, the anterior of the chest, the anterior hip, and most importantly is this, is that your palms are faced upwards in a supinated fashion. So in this case, what we want to do in anatomical positioning is have our palms up. The reason why we have it in a supinated fashion is because when the palms are up, the radius, this bone right here, and the ulna, this bone right here, are going to lay side to side. If our palms are down, we say it's in a pronated way. What happens is that when pronating it, you're going to crisscross the radius and the ulna, making it almost impossible to describe it with any kind of veracity which one is which. So the easiest way to have anatomical positioning is to have palms face up, and then the radius and ulna turn to their side, and then now they lay side by side parallel to each other. When you're looking at the rest, understand that when we're looking at like the skeleton, anything, and I want you to have an imaginary midline completely bisecting your body into left and right halves, right? Anything close to that midline is called medial. Anything away from it is lateral. So when we look at the skull, the nose is medial compared to the eyes. The eyes are medial compared to where the ears would be. Now, when we're looking at lateral, right, lateral is further away. So the ears are the most lateral aspect right here. How about superior and inferior? Superior is above or on top. Inferior is on the bottom, right? So that's pretty easy to understand. The only other thing is proximal and distal. Proximal and distal usually refers to a point. So if I'm using this as a point in the elbow, anything closer to it, like the part right here of the radius, this will be proximal, whereas your fingers will be distal to that point.